Welcome to the Menopause and Cancer podcast, where we speak with cancer patients, survivors, doctors, and amazing experts in their field to help us find solutions to our symptoms and also ideas to improve our health. My name is Danny Binnington, and today we're going to be talking about sexual health. Many women say that they've not been able to have sex with their partners in many years because it's so painful. Many people say that they're experiencing vulval, vaginal, and bladder issues. And so I've got two experts in the room with me today to help us find answers to all of our questions. Lavinia Winch is a sexual health educator and Yes ambassador. And also we are joined by the wonderful Dr Carys Sonnenberg, a menopause specialist and GP. And both of these lovely ladies are going to really help us understand what our options are. I'm also joined by a whole group of these wonderful women in my community who are joining me live on today's recording so that they can ask the questions that are most important to them for our experts to then find the answers for. I hope you enjoyed this episode. It's definitely a get the pen and paper out episode and put your thinking cap on. And I really hope you enjoy it. So I am sat here with the gorgeous Lavinia. Lavinia, you're a women's health campaigner. You're a cancer survivor yourself. And I don't know anyone better equipped to talk about vaginas, vulvas, all things sexual health and empowerment than you. Thank you for joining us.
That's a pleasure, Danny. Thank you for having me.
And we'll also be joined by Dr. Carys Sonnenberg, who will take on the more medical questions about sexual health, like vaginal estrogen. Lavinia, before you were diagnosed with cancer, you had an experience of perimenopause and some vaginal atrophy issues. Can you talk us through what that was like before you even had a diagnosis?
Yeah, well, actually, it started way even before perimenopause. It started really when I first began to be aware of such a thing as vaginal dryness or the more severe vaginal atrophy was after I had my first baby. And I was breastfeeding, completely breastfeeding, no formula at that stage. And as a result, when you're breastfeeding, you're not ovulating, there's very little estrogen around. And so vaginal dryness is one of the symptoms or the side effects of this wonderful thing that you're doing with your gorgeous new baby. I didn't know this. I didn't have any background or experience to understand what was happening. I didn't talk to anybody about it, but basically what we did is we went out and we bought a lubricant, and we're talking about 1980. Because I'm very old now. That's when I had my first baby. And in those days, the only thing available was KY. And what I didn't realize was that actually this was causing me a lot of vulval irritation and vaginal soreness. And so quite frankly, sex after childbirth was very, very difficult for us. And I suffered from a lot of side effects. I went through a lot of medical sort of investigation to see what was going on, but nobody ever asked me whether I was using any lubricants or what was going on. And so that sort of went on for a very long time. And then, of course, going into perimenopause and towards menopause, those symptoms became worse. Along with the urinary symptoms, which many people don't realize are also associated with perimenopause and menopause. So I went to a urologist, and he gave me a cystoscopy and said there's nothing actually wrong, but he didn't click that in those years, sort of round about 50, between 45 and 50, as our estrogen levels decline, that affects our bladder and our urethra as well. And so I was left in the lurch again, nobody really being able to help me, until I found a urogynecologist who said absolutely classic signs of perimenopause and menopause. Those bladder symptoms are very, very common alongside the vaginal dryness. So you might not even feel the vaginal dryness as a symptom, but you might be experiencing some of those bladder symptoms. And that's when I started to get on the right path with the right treatment.
So for someone that has sought out health care and help, you must have felt very much let down for years and years and years. And this has gone on over more than 10 years for no one really being there to help you.
Yeah, it was, we're talking about between 1980 and 2000. And, menopause wasn't in the public arena. It wasn't talked about. There weren't documentaries. There was nothing. So my only experience of menopause was my mum and her hot flushes that she had round about 50 when we were traveling in America. And she used to keep popping into shops to cool down. She never talked to me about it. I honestly knew nothing. And I don't think that's very unusual, particularly back then. Luckily now, there is much more information available for people, and people like yourselves, and with social media, there's so much more information. But that's really why I'm so passionate to make sure that people have that knowledge, have that awareness, understand their bodies and what's happening so that they can seek the right treatment. Because for me, it took a very, very long time to get the help that I needed.
Yeah. And before we talk a little bit more about what happened then when you were diagnosed with cancer, you just mentioned it's not always just a dry vagina. Let's talk about the other symptoms that women present with, so that everyone who is here with us today, live on this workshop or listening back on the podcast, can kind of identify what we're talking about. Hey, thanks for watching this episode. 73% of people who watch my podcast haven't yet clicked the subscribe button, and 11% haven't hit the button to turn on notifications. I want these conversations to reach as many women as possible who might need to hear them. So if you've ever enjoyed listening to this podcast, please hit subscribe now.
So dryness, some people say, what does it actually mean when you talk about a dry vagina or vaginal dryness? Well, in terms of what you might feel, for some people, it would only appear really when you're having sex. So sex can be quite painful. For other people, it might be that you are just finding it's uncomfortable when you walk, it's uncomfortable when you sit down. Riding a bicycle, you might be very sporty. So for everybody, it's very different. Sometimes it's an itchiness, and it's not just internally in the vagina. The vulva can also be affected. So some of those symptoms might feel a little bit similar to thrush. And in fact, that's, in my case, I was actually suffering from a reaction to a not very nice lubricant, but that itchiness and that soreness could well be very similar to thrush. And so you might just treat yourself with Canesten or go to the doctor without realizing that actually it's something altogether different. It is vaginal dryness. And vaginal atrophy is a more severe form. That's when the tissues of the vagina become much thinner, they become much less stretchy, they're less elastic. And that's one of the reasons why sex can be really painful, because you haven't got that lovely, stretchy, soft vagina. So it's a sort of a myriad of different symptoms, and for everybody it will be different. Even for some people, there can be an excess of moisture. It can be a little bit of a discharge. That doesn't actually mean that your vagina is well moisturized or well estrogenized, but actually it is also a symptom of vaginal dryness, perhaps a rather watery discharge. So for everybody, it's different. And I think what has to be very aware of is noticing the changes for you. You might have thought, oh, something's not quite the same. Think about it and listen. And actually, there's one more really important tip. We should all be used to looking at our vulva. We should have a mirror once a month. Have a good look. If something doesn't feel quite right, have a look and see what might be going on and make a note of what those changes are. And if you're not quite sure, then please, please do go to your GP. If you have a women's health specialist in your practice, that's a really good place to start. But do seek help from a medical professional if you're experiencing any changes which are different to what you've experienced before. I hope that's helpful.
And when we're not going to do a poll. We just did a poll earlier on with all the ladies who are live here. I'm not going to do a poll of how many of you have had a mirror out and looked at your vulvas, although I'd like to know. We're going to do that another time. The symptoms can also extend to our toilet function, right? To how often you need to feel the feeling that you need a wee all the time, all the way to bladder infections. Talk about those a bit, because they're all part of what we're talking about today.
Yeah, so I'd mentioned a little bit. So frequency and urgency. are some of the symptoms, and a feeling that you never really quite have emptied your bladder. Now, again, these can be mistaken for the beginnings of a urinary tract infection. So it is important that if it's painful when you're actually weeing, then it is important that you go and have a urine specimen taken. But it's the lack of estrogen in around that whole area that can make those symptoms very obvious. So the stress incontinence, a little bit of leakage, that urge incontinence when you think you get to the door and you think, oh my God, I'm going to wee absolutely immediately. So those are also related to the fact that there are estrogen receptors within the bladder and the urethra. So that's why the term vaginal dryness or vulval vaginal dryness, which was previously used to cover vaginal dryness, has now been extended. And it's now called genitourinary syndrome of menopause, to incorporate the urinary symptoms, which many people experience. And that might actually be the first thing that you experience even before you're aware that you've got vaginal dryness or vaginal atrophy. And that was the case for me. It was in perimenopause, and that's why I went to a urologist. And it's just unfortunate that way back then, the urologist didn't put the two together. And as I say, it wasn't until I met a urogynecologist, so that's a gynecologist that also specializes in urology, that they said, absolute classic symptom. And then after that, I did experience more of the vaginal dryness that I'd had postnatally as well.
So what help did you get when you then were offered help and support?
Okay, so then I was offered HRT, and I was very happy to, having looked at the research that was available. So I had an estrogen patch, and I used vaginal estrogen. I know we're going to talk about that later with Dr. Sonnenberg. And then I also started using vaginal moisturisers on a daily or 2 or 3 times a week, and also vaginal lubricants, really good organic water-based lubricants or oil-based lubricants for when we were having sex. And all those things helped tremendously. And because I was using HRT, a transdermal patch, my transition into full menopause was actually much easier for me. I mean, we'll talk about later what happened when I was diagnosed with cancer, but to begin with, through those early years through my 50s, the HRT helped me tremendously. I didn't have any hot flushes, and I know that that's more problematic for anybody that's had a breast cancer, but for me at that stage in my life, that helped me tremendously. So both the transdermal patch and the vaginal estrogen and vaginal lubricants and moisturizers sorted me out.
So then I know you were diagnosed with cancer and you were told to stop your hormone replacement therapy, which I know for many women listening is also what they've experienced. And I know it can feel like a double whammy. Many women are worried about having to come off the HRT because it's helped them feel so much better. They don't know what other options they have. You were told to come off your HRT. Talk us through your cancer diagnosis very briefly.
Yes, so I was 62 when I was diagnosed, so I was sort of, post-menopause, but in a good place in terms of my hormone levels on HRT. I had a little bit of spotting, and I hadn't had a period for many years. And because of working in women's health and because of the job that I do, because I've been to many, many conferences, I knew that was really, really important to go straight away. So I didn't think, oh, that's nothing much. It's just a little bit of spotting. I won't worry about it. But I went straight to my GP, and postmenopausal bleeding is a red flag. It is very definitely something that needs to be checked out. I was lucky that I knew that. And so I was referred straight away on the 2-week course. And I had a hysteroscopy, which indicated that the lining of the endometrium was thickened and that there was something there that they weren't very happy about. And so after they've tested it, they then came back to me and said, yes, you have got it. It's a very early stage. It hasn't spread, but we advise you come off your HRT and you will have a full hysterectomy. So that means ovaries, fallopian tubes, womb, and cervix. For me, postmenopausally, that wasn't too much of an issue, but for somebody much younger, that can be a much bigger and much more challenging situation to find yourself in. So I have to understand and appreciate that my individual story will be very different to anybody else's. So I was under a very good surgeon. I wasn't given any information about what would happen after the surgery. But I was anxious afterwards to know whether I would be able to go back on my HRT. And that had to be a discussion that I had to have with my oncologist, and will probably be related to the type of tumour that the cancer was. And in due course, I was allowed to go back onto the transdermal patch and vaginal estrogen. But there were other issues that popped up in terms of my sexual health and well-being and my relationship, which I'm happy to talk about at some stage if you'd like me to, Danny.
Yeah, and I love your openness. I like how reflected you are. It is so very different for every single person listening to us, right? It seemed like you had a good conversation with your oncologist. We know women that haven't even ever met their oncologist because they were diagnosed in perhaps through lockdown, and it was only ever a telephone conversation, or they've just been speaking to their specialist care nurses. And so everyone's experience is so different, and we need to help everyone start where they're at, isn't it? And whoever is listening to this conversation today, we really want to tackle everything of what we can do at home before we even go to our doctor to look after our sexual health. Because I feel like I had to go into my 40s to even know how to look after my vagina and my vulva. And I think there is so much learning and basic information that I never had, and I guess many people have never had.
Absolutely. That was completely, I had to learn for myself, really. And now looking back, I'm just so pleased that I know so much more. And the reason I share my story and I speak so openly about it is I really want other people to feel that they can also be open about it and not be afraid to ask for help. And nobody is ever alone. These symptoms and these conditions, whether it's just part of a normal, straightforward reproductive and post-reproductive life, or even postnatal, or whether you've had a cancer diagnosis, these are incredibly common symptoms. And so it's really important to feel that there is somebody there that can help you and can talk about it.
Yeah, absolutely. Let's talk about your journey of then becoming a Yes Ambassador, because I know you're so passionate about helping us, and you really taught me how to wash my vagina and my vulva, what products I can use. You've been really an integral part of me feeling more informed. Why have you become so passionate about this then? Because I know it's one thing having a personal journey and experience, but it's another thing than trying to teach everyone else about it.
Well, it was my own experience until I met Susie and Sarah, who started the Yes Company in 2003. And then their research took 3 years to find a product that they felt was really, really going to benefit vaginal and vulval health. And I met them in 2009, and they asked me, well, I actually asked for a job. I said, please, can I come and work for you? But at that point, I still didn't know that all my previous problems were related to using poorly formulated products. I didn't understand about lubricant formulation or vaginal moisturisers. I didn't know that most products are formulated with glycerin, which can lead to thrush, which can irritate. So my journey and my experience and my wanting to share my story is inextricably linked to the fact that I found a job. And apart from anything else, to start a job when you're 59, which has really turned into a career, was just, in terms of personal development and personal growth, I just have to be so grateful to these two brilliant women for allowing me to do that, and then to share my story and share the knowledge that I've gained from going to over 200 medical conferences, listening to some of the top medical professionals in the world. So it's not just my own personal experience, it's having learned so much about women's health through these conferences and speaking to these medical professionals. that I then feel I can signpost people, I can help people and understand why you really have to be very careful about what you use in your vagina and on your vulva. And that's where I am. And it was having stepped back from my role as medical liaison, where I was going to just so many conferences, I couldn't step away altogether. And so I said, please, can I be an ambassador? Can I continue to spread the word about the importance of vaginal and vulval health? But the Yes story is absolutely part of that journey.
And I think there's something so inspiring and powerful to embark on a new career when you're in your late 50s, especially once you've had a cancer diagnosis and many other things like we all do that have happened in your life. And I want you to teach us in the next 20 minutes everything you've learned in all of those 200 medical conferences. Go.
Oh my gosh. Okay. Well,
No.
No. And well, almost everything I've said so far has been a combination of what I've learned, papers that I've read, research that I've read, and put that together to my own experience. So you can imagine I'm sitting in a conference and they're talking about the symptoms that I have experienced. So not only am I learning for myself and learning so much more, but I'm also learning that I can help point people in the right direction, because I'm not medically trained myself, but I have learned so much and it's been so fascinating. So yeah, the most important thing about using products on the vagina or the vulva is that you have to be very careful about the ingredients. And we now know, and to be fair, it was Sarah as a chemist who realized way back in 2003 that many of the products out there contain glycerin and glycols, which can irritate. Some of them have sort of perfume in them as well, parabens, which we want to avoid because they're hormone disruptors. And so the purity of the Yes products was really important. And that's what everybody needs to know. I think Sam Evans says a great thing. She says, be an ingredients detective. So don't just pick something off the supermarket shelf. Look at the ingredients. The pH of a product is really important. We need to remember that our vaginal pH is fairly acidic. It's around about 4 to 4.5. And the reason it's like that is to help prevent infection. So if we put a product inside the vagina that is more alkaline, that means a higher number, then you are going to change the biome. You are going to be much more likely to have an infection. Those infections can be a urinary tract infection, it can be thrush, or it can even be bacterial vaginosis. So that is hugely important. There are other slightly more complicated scientific chemical reasons why our products are so suitable for vaginal use. I'm not going to go into them now, but if anybody wants to look up on the website, or if they want to Google the word osmolality, it's closely related to the ingredients. Those are the really important things. So pH is really important, and avoiding any products which might irritate or might change the vaginal biome. That's the good.
So if I go into if I go into a chemist and I see a whole row full of lubricants, vaginal moisturisers, washes, how many of those do you think will contain some of those ingredients that we want to stay away from?
Well, I know this sounds unbelievable, but very, very few. I mean, honestly, they are produced by big pharmaceutical companies, and very, very few of them will be free of the products which can cause irritation. I know that sounds as if I'm just promoting something, but honestly, the science is there and the evidence is there. You only have to look on the pack. If you find something that works for you, then that's absolutely fine. But if you use something and you find, oh gosh, that's a little bit stingy, or that I seem to have developed thrush, then you'd know that there's something in that product that has caused that problem. And we're all different. Some of us are more sensitive than others. But in terms of really good vaginal health, oh my goodness, it's just so important to use a product that is pure and has been really responsibly formulated for vaginal and vulval use.
Like, I know you are even unhappy with some of the products a GP can prescribe. Is that true? Because you've said that to me before.
Yeah,
How is that
it is
possible?
true. Well, again, it probably lack of knowledge, from the original manufacturers of the products. There is a fantastic paper which was written in 2015 by the wonderful Nick Panay, who's a brilliant menopause specialist, and Dr. David Edwards. And what happened was that a whole range of products were sent off for testing for pH and osmolality, and they came back with those results, and those are published in this paper, which is available online. And in terms of prescribable products, yes, is the only product that falls within the range of pH and osmolality that's available on prescription. So there are other products, and there will be something that's got hyaluronic acid in it, for instance, which is a very good moisturizing product, but because of the other ingredients in it, that might cause irritation. So it is absolutely true that the GPs don't have this knowledge. We are trying to make sure that they understand the difference, and the paper is out there. It's been read online something like 22,000 times, and it's been quoted in another 50 research papers. And Naomi Potter has also written a paper explaining the importance of ingredients as well. So the information is out there, the science is true, the evidence is there, but unfortunately the message hasn't reached all the GPs or gynecologists or breast cancer specialists.
And that's when it's upsetting and frustrating, because when someone goes to the GP and says, I've got problem with my vulval health or vaginal health, that is never easy. Like, I know it's very easy for you, perhaps for me, to talk about our vaginas, but for the majority of people, it's actually quite difficult to present with those symptoms to the GP. It's much easier to say, I've got a dodgy elbow. And then to be prescribed something that might not actually be great for us, that actually includes some of the ingredients that are really not brilliant for us. It's really disheartening, isn't it, when you think of that whole process?
It is indeed. And you might not go back then. You might just think, well, if that's meant to help, but it hasn't helped, obviously there's nothing else I can do. But there is always something else you can do. There is always something else that should work for you.
And we'll put them in the chat box. If I'm not asking them, Lavinia, now, I will ask them towards the end of the conversation. Where do we start with vaginal and intimate health products? How do I wash? What can I do on a regular basis before I even have to go to the doctor? What helps?
We'll talk about washing first. So first of all, we must remember that we don't wash inside the vagina. The vagina is self-cleaning. We don't ever do any douching. We just leave the vagina alone. But the vulva is really important. Some people are happy just to wash with water. You definitely don't want to be using any shower gels or any perfume or any soap. You want to use something that is very, very natural. And we were asked by our customers to produce something. Some people feel that by producing a product for washing the vulva, you're suggesting that the vulva we want it to smell nice or something like that, but it isn't like that. If you have a little bit of urinary leakage or you've had a period or something, you might want something a little bit more. So we do have a product called Yes Cleanse, which is soap-free, glycerin-free, pH balanced, soap-free, glycerin-free, and paraben-free. It's just a very gentle foaming wash, and it comes either in an unfragranced version, or we have one with a tiny bit of organic rose oil. And actually, we've had people who've used that all over their body, people who are going through chemotherapy, who find their skin is very, very sensitive, or some people during menopause find that their skin is ultra sensitive, or have that sort of creepy feeling of their skin is very dry. So some people will use it all over the body, and that's absolutely fine. So that's washing the vulva. It's entirely a personal thing. Some people would like something, other people, as I say, are just happy to use water, and that's fine. Then if we talk about moisturizing, we moisturize our face every day, probably twice a day. Our skin, as we go through menopause, or if we've had cancer treatment, can get much more dry in the same way that our vagina does. So we do have a vaginal moisturizer, which is a very lovely pH balanced, water-based, and we would use a vaginal moisturizer on a regular basis for a long period of time. You don't have to, it's not a question, oh, I'll use that for a year and then stop. Once you stop using something to help with vaginal dryness, the symptoms will just come back again. So a vaginal moisturizer, and I've got something here. I'm going to show you on the camera, just a very light gel. It's designed to be exactly like your normal moisturizer. Okay, that very, very light.
So where do you put this? Where
you put
this on your vulva or inside?
You put it inside your vagina. You can put it on the vulva as well. It either comes in a tube or it comes in these pre-filled little applicators. So that's the difference. A vaginal moisturizer is for long-term regular use, whereas a lubricant is what you would use for sex, before sex, to make sex more comfortable. Very similar formula, but the vaginal moisturizer is designed to release the moisture over a longer period of time, whereas for sex, you want something where the moisture is going to be released quite quickly. And that's where the water-based comes in. So this is water-based, pH balanced, very, very natural feel, and can be used with condoms. It's a very light gel. I don't know how easy that is to see. Can you see that?
I can see that, yeah, okay. I can see that, yeah.
And the lovely thing about this product is that after sex, it just gets absorbed beautifully into the tissue. So it also can provide some moisture. You don't feel you've got to get up and wash it off. It's very slippery slidey and very natural feeling. And a lot of people their partners wouldn't even know that they were using something. It feels exactly like your real moisture. But a water-based product will always get absorbed fairly quickly. And that's why Susie and Sarah came up with this brilliant idea of a plant oil-based product. We call this
Can I just interrupt you? Yeah. I'm going to interrupt you because the lady just said, what a lovely, knowledgeable lady Lavinia is. I could listen to her all day. Carry on then, carry on.
That just makes me so happy. Thank you, lovely lady, thank you. Yes, oil-based, because I've mentioned that the water-based gets absorbed fairly quickly, so you might need to reapply, but some people would like something that is longer lasting, and that is where, yes, oil-based comes in. So this comes out like a cream, so you can apply it.
Oh, quite different.
Yeah, because it has shea butter, cocoa butter, beeswax, it has sweet almond oil, it has vitamin E, it's certified organic, and it just softens into an oil. And again, what this does is it gives you protection. So if you're anxious about any friction or you're feeling that things are going to be uncomfortable or hurt, this is very, very protective. It's very long lasting. It doesn't feel quite as natural. You can see now that's just an oil. It doesn't feel quite as natural as the water. But we have another fantastic thing up our sleeve. Shall I talk about double glide?
Go for it.
So, the technical term for painful sex is dyspareunia. And we have worked very closely with a wonderful psychosexual therapist called Ruth Hallam-Jones. And she discovered that if you put the oil base first in the vagina and let that give you the protective feeling for the tissue, and then you put the water over the top or on your partner or your toy, whatever you're using, what happens is that the oil prevents the water from getting absorbed so quickly. The water slides over the top of the oil. Some people call it slide and glide. Some healthcare professionals have developed their own term for it. We call it double glide. And what happens is that the water then lasts much longer. It feels very natural, but the oil is giving you the protection from any friction or discomfort that you may feel. And this is something that has been really, really recommended by psychosexual therapists, by gynecologists. So it's the double glide. What you do have to remember is that let me just quickly say, an oil-based product cannot be used with condoms. No oil, whether it's coconut oil or olive oil or almond oil, you really mustn't ever use, because the oil can deteriorate the latex of a condom.
I love that you are here. It means so much to me and my whole team behind this show. We release this show for free to help people like you learn more about this often misunderstood topic. And because so many of us feel totally under-supported going through all of this. In return, all I ask is that you help me on my mission by hitting the subscribe button and clicking the button to turn on notifications. It really helps a lot. Thank you. And now on with the show. So we kind of have to separate those products, don't we? The lubrication is there for when we want to embark on sexual intercourse or activity or play or stimulants. And then the moisturizer is something, like you said, we protect, it can soothe, it can really help with some of those symptoms. And I wonder if our amazing Dr. Carys Sonnenberg is in the room already. Carys, are you here, my lovely? Would you like to unmute yourself? I have already introduced you, Carys. You're a menopause specialist, you're a GP, you've got so much experience, and I know you're a real trooper for campaigning for more education and support for people with a history of cancer and in menopause, and I'm delighted you're joining this conversation. Lavinia has really talked so brilliantly about her experience and all of the different transitions she's just gone through. We've just talked about moisturizers and lubes. When people come to you as a GP, I want to know, what do they say? Do they often say to you, I've got a painful vagina? Or how is that conversation? How do you get that information out of people?
I ask everyone. So I don't find many people volunteer that symptom themselves. So because of the nature of my work with women's health now, I do 2 days on the NHS, and I ask everybody the same question. So I've now started, since I've been doing more work with menopause, I now offer advice for menopause for almost every woman I see. I send her the information. So no matter what age she is, particularly as I fit long-acting contraceptives. So I ask women, no matter what age they are, about whether they've got menopausal symptoms and their periods are changing. And if you don't ask, you just don't hear the right information. So it's just so important to make sure you're asking the right questions. So I now ask everyone, no matter what age they are, whether they're 18, in their 20s, in their 70s, and I use leaflets now, and I've got so little things that I've made with and laminated, and I've got products that I show women on my desk. So we talk about what sort of things they prefer and what's available and what and how common this genitourinary syndrome of the menopause is, and that you don't need to suffer. And I explain what happens to the anatomy of the vagina and the bladder. So then women start to understand about what's happening to their body and how things are changing and why they're changing. And then they're very happy to discuss it. But I think it's something that if you don't ask, and apparently even if you do ask, many women will not feel comfortable talking about it, and they might want to, but you have to open the conversation. That's what general practice often is. Yeah. We have a short period of time. So we can't deal with everything in each consultation, but what we can do is open the door so that people can come back in and talk about it. And it might be something I say, okay, so Lavinia, I had your website up yesterday. So I was saying to a lady, okay, here you go. This is, we've run out of time now. You've been 20 minutes and things are long, but this, I want you to look at this. So snap it. So I have things up. So I text people lots of information. And I say, this is the website you're looking for. This is what it looks like. This is the vaginal moisturizer bit. Snap that. This is the lubricant part. Snap that. So go away and have a look at them at this. And at your next appointment, then I know you've started to think about it a little bit more, because I find giving people a lot of information in one 10-minute slot is just too much. There's so much to cover. So they need to have the door open to discuss it, to start thinking about it, then be sent information, and then to come back when they've reflected and they have thought about exactly what's going on in their body. Because sometimes this is the first time they would ever have spoken about these symptoms.
Yeah.
They might not feel comfortable, and they might also not really have thought about it in enough detail to answer the questions accurately for them. So if you put them on the spot, it doesn't always help. So it's good to say, look, actually, this is really common. Would you like me to examine you? And often women are really grateful to be examined because, you know, no one's looked at that part. There's maybe a part that they're worried about that they don't know whether it's normal or not. So so this week I always say to ladies, do you look at your body? Do you look at your vulva? Do you know which parts are okay? And a lot of women are frightened to look at that part of their body because they just don't know. They don't want to do it. So I have to say, you're not going to hurt yourself. It's completely fine. You can examine inside with a finger and touch your cervix. You're not going to hurt it. And after surgery as well, you might find people who've had a hysterectomy and have a lot of discomfort, particularly if that's after endometriosis or something similar. So once things have healed, it's starting to get them to be confident to look at and feel what's going on there. How is it different? Look at it. How does it look different if they're comfortable? And how does it feel? And so they can massage the scar and be comfortable that they are to touch that part of their body, so they can make sure they're feeling a bit more relaxed. If someone else touches that part of their body, they're not so worried.
Yeah,
there are lots and lots of things. Sorry.
No, Lavinia has just spoken so brilliantly about the use of vaginal moisturisers and safe lubricants and ingredients, and how we're so not clued up about ingredients. Do you feel this is the first step for most women that come into your practice presenting with vulval, vaginal, bladder symptoms to really get onto a good moisturising routine with safe products?
Yes, definitely. And I think educating women about intimate health is really important. So making sure, seeing what they're doing at the moment, because so explaining to them that before the menopause, their vagina is this lovely, as we know, this self-cleaning oven that we describe it as, and that actually the walls of the vagina replenish themselves every 4 hours. They shed and they make new cells, and they're very healthy and bouncy and supple and springy, and they've got lots of lovely folds, and everything looks moist and healthy. And so therefore, if you do have sex and there's a tiny little abrasion, that usually heals really quickly, because the vagina is wonderful at doing that. It has a lovely acidic pH of about 4.5 to 5.3, so it's very happy in its own environment. And if you put things inside, then you may change that acidic nature of it, and that then can put you at risk of infections. You've got lots of lovely lactobacillus in there. They keep the vagina nice and healthy, so we don't want to be wiping inside or washing discharge away. And if we have discharge we're not happy with, we should go and get it checked out to make sure there's no infection that we need to be treating in a different way. And then when we lose estrogen, we see those vaginal walls thin, and the bladder walls can thin, and we can have a little bit of shrinkage of the outside of the labia, which leaves the urethra more open. So we can start to get, and the vaginal wall doesn't replenish itself as often, and the acidity may change, the lactobacillus levels change. So we see changes that are going on. The bacteria with the thickness of the walls, and things are very fragile and thin, and they can bleed more easily. And we can see that with the bladder as well. So we have women who come in with vaginal soreness and itching and bleeding. And a lady today was describing it, that when she had sex, when the penis came out, it might have blood on the penis. And she said that was really frightening for them both. So she's now gone away with another. She was already taking a product like this. So there are 2 receptors for estrogen in the vagina. There's estriol and estradiol. And she was taking a cream, which actually was an estriol cream here. Can you see? So that you can put that in, and that was what she was using. So we've added an extra estradiol cream in for her as well, to try and help that, because she said this was really helpful, but things need a little bit of an improvement, and she's been on it for a while. So we can really help people with this sort of thing when sex becomes uncomfortable, and we find the symptoms start, and the bladder symptoms can also be really distressing. So people may more frequently pass urine. And they can get infections. They can get up at night going to the toilet, and they get that horrible urge to pee, where they put their key in the door and then they simply just can't quite make it to the toilet. So those things can be a real problem.
The cream you have just mentioned, that is more than a vaginal moisturizer, right? Is that a vaginal
This is,
estrogen
yeah.
already?
So this is a vagina. So I would say, so the non-hormonal treatments are the ones that Lavinia will have talked about brilliantly, because I know we've spoken before, and they are absolutely brilliant. And choosing the right one is very important. So some women will try putting all sorts of things inside the vagina. I've seen detox, TCP, anything to try and clean out or to try and help. Women often go to great lengths to help themselves in this sort of situation because they don't want to be examined or to have the embarrassment of talking about it, and they want to try and help. So they will find anything they can to try and help. And men are the same. Anything that's going on that they're embarrassed about, they try and self-help quite a lot. So Sudafed is not Sudafed, Sudocrem. Sudocrem is one that's quite commonly used. Vaseline. People sometimes wash inside the vagina with soap. So remembering that an imperial leather soap has got a pH of about 11, and our vagina's got a pH of about 4 to 5. So that's going to really change what the acidity in the vagina, and that won't help them. So we try, the intimate care regime, not douching, for example, washing just with water around the lips. And then we look at the non-hormonal things that now we're able to advise them on, and not buying one that's going to make things worse for them. So one from the shop that might actually be making the symptoms worse. And often people will try things for a very short amount of time before they say it doesn't work. So you've got to really go back in the history and say exactly what was that, and how long did you use it for, and what were you doing at the same time. So you can really try and unpick what people have tried to do to support themselves. And then, yes, we're looking at hormonal vaginal estrogen, which is not HRT, and can be used safely by very many women, even after cancer. So when we're looking at cancer diagnoses, for example, if we were looking at a breast or a gynecological diagnosis, these women can still use hormonal vaginal estrogen. And it sometimes is a case of looking at the tumor and the markers of the tumor, and exactly whether it's estrogen dependent, what type of cancer it is, and then talking with your oncologist and your menopause specialist about whether vaginal estrogen treatments may be suitable for you, because in a majority of cases they are. And it is really a case of opening the conversation and being knowledgeable about the types of treatments that are available, so that the conversation can then be opened with the specialist and oncologist, so we make sure that the treatment is safe for you, speaking about possible risk of recurrence, what type of cancer has been treated. So that's where we are.
So Carys, we just had a question, and the lady said, is Vagifem okay to use? I haven't had sex for over 5 years as it's too painful. That's not an isolated case. Like, you must hear that a lot, that women stop having sex, and then a lot of pleasure goes, and intimacy goes, and relationship changes. And sometimes we end up being 5-10 years after our primary diagnosis, and so much has changed as a result of some of the side effects. And it can feel like your whole life is crumbling because of it. It's really disappointing.
Yeah, no, I completely agree. I have conversations with women every day about this, about how and I spoke to our PCN group of doctors about it recently, about how important it is to speak about sex and to speak about intimacy and pleasure with women, because many women, they may have pain, they may have loss of libido because of pain, they may have loss of the ability to climax because they have some changes around the clitoris and around the labia, so it can be more difficult for that to happen. And sometimes they're frightened because they may have had an operation, maybe hysterectomy or maybe removal of some tissue, and they're frightened that's going to be uncomfortable, or their partner's frightened. And then they can come in talking about the difficulties that can cause between the relationship between them and their partner. And often they will say, look, my partner's really understanding, and he doesn't want to put me under any pressure, but I'm actually really frightened about losing him. So I have sex because I have to, not because I want to, and it hurts, but I don't want to not do it because I'm worried for what will happen to our relationship. So I think it's really important we look at intimate issues and we're able to talk about it really openly and freely, because these sorts of treatments can make things so much more comfortable. So they are really low dose in estrogen. They are started, and for a majority of cases, they can be started using it every night for 2 or 3 weeks, and then you use it ongoing, maybe twice a week, sometimes more often. Sometimes we can use products together that make them a bit more effective. And they're really, you can find, I'll show you some products that you can use now. They can cause a little bit of irritation for a couple of weeks. So it's really worth mentioning that to people, because sometimes people will get a bit of irritation and then they'll think, oh, this isn't for me. I don't think I can carry on this way. So that could sometimes happen to start. So expect a little bit of change of irritation for the first couple of weeks, and then they take about 2 to 4 months to work. So don't expect it to be something that's really quick. It could take a little bit of time to work. So still keep going with the treatment and try and remember to take it regularly, because it's the sort of treatment that you need to keep taking. It's not something you take for a month or so and then it stops. It's a long-term, lifelong treatment. And there are lots of different types of treatment. I've got some products and some little little pictures like this. So there are 2 types. So there's estriol and then there's estradiol. And the one that I sometimes start with is a little. You see, those are teeny little tablets. So those can go up inside. These are estradiol 10 microgram vaginal tablets. And they are inserted using a little applicator. Now, there are 2 types of these. So this one is Vagifem. This applicator is a daily applicator and is thrown away. This one is Vagirux. This white applicator in these boxes is reused 24 times. So it's a little bit more environmentally friendly, but it is the same product. And what you do is you put the little tiny little tablet in the end. Oh, I think you can see it. Yeah, and then you push that inside the vagina really gently, not worrying about hurting yourself or worrying about, so as far up as is comfortable. And then you've got a little tiny plunger that you just release there. So it's really easy and gentle if you're happy to use something which goes in with an applicator.
Carys, one lady is just asking, is it possible to also use your finger rather than the applicator, as the applicator is quite uncomfortable?
Yes, so you can, but I don't know that it would be that easy to fit this into the vagina. But yes, of course you can. If you think something's uncomfortable, then you don't need to do it. And we've been discussing recently about what sort of applicators you could use that are more comfortable. But there is, so that, for example, is Vagirux and Vagifem. So it's an estradiol 10 microgram little tablet. There is this one, which I love. It is Invagis. So it's like a little bullet. It looks quite big, but it's not. And it's really moisturizing. It's lovely. So you can put this in with your finger, and then you're more in control of where you're pushing the tablet. So you know that you're going to be feeling anything. You're not going to cause yourself any damage, which an applicator could do for some women. This is estriol. This is every night for 3 weeks, and then you use it twice a week ongoing. And lots of women love this because it's something which they've got a bit more control over, and it's a bit more moisturizing. Some women find it has a little bit more discharge and they don't like that. So it really is very much personal preference. This one here is Blissel. This is a really low estrogen, so it's an estriol cream that goes into this little applicator. You see? And then you just gently plunge that inside. And you can use that inside the vagina, or you can use that outside the lips. Because sometimes people get sort of almost little paper cuts around the vulva, which are super, super thin. And it's like you've had a little paper cut, and it's so, so uncomfortable. So you can use this cream around the outside, and you can also use it inside. And that can help. So what it does is it will help to reperfuse the tissues, make them a little bit make them thicker, bouncier, more supple, more healthy. And it also will help with the clitoris. If the clitoris has shrunk back a little bit, it will help to encourage that to become more healthy and to regain itself. And it can also help with the bladder. So putting it inside the vagina, because the bladder and the vagina are so rich in estrogen receptors, we can find that when we put it inside the vagina, it helps the bladder symptoms as well. So women who have got frequency of urine, who got being up at night, one thing I really like is a bladder diary. So this is my one that I was going to show you. So you just write down what you drink, how much you drink, and when you drink. And you measure with a little jug how much you weigh. So you just have to have a jug with you all day. And it helps me very, very much, because I don't know whether you're a real coffee drinker and you have 25 cups a day, or whether you are someone who drinks fizzy drinks, or whether you drink most of your drinks in the evening, that's why you're up at night, or whether you don't drink much at all because you're worried you're going to have an accident when you go out. So it's so helpful. I love this so much. And I love to see how much your bladder can hold. So can you hold 400 mils overnight and then get up and have a really big wee in the morning? Or can you only hold, 90 mils and you're on the lube 25 times a day? I see so much, and this is incredibly helpful. And then we look, because sometimes we have an overactive bladder going on alongside all these things that happen in the vagina. So one other thing I really love is this bladder training chart. So this gives us, if you're someone who's going to the loo 50 times a day, you need to try and help your bladder. Remember, your bladder is a balloon. Help your bladder learn that it can hold a bit more. So maybe try holding on just for a few minutes and then going. So we're all a bit guilty, aren't we, of trying to, I'm just going out, I might need a week. So we need to make sure that our bladder is able to hold a good amount, and that it's not and that we're not it's not going to squeeze and let us have a leak when we're out and about. We want to get used to doing that. So these vaginal estrogens can help the bladder and an overactive bladder as well. We have other creams here, if you can see here. So we've got Ovestin, which is an estrogen cream, and the estriol cream. Those may be pretty much the same thing. Yes. And then we've got this lovely, can you see that? Beautiful estrogen releasing ring that sits inside. So if you're someone who's a little bit worried about touching and forgets, because with the best will in the world, remembering something twice a week is not that easy. So if you'd like something that stays in there for 12 weeks, then you've got this really springy little plastic ring that pops up inside. It doesn't fall out, and it releases lovely vaginal estrogen into the vagina. And then you've got that inside. That that's all okay. You can have sex with it in. You can put it in yourself. You can take it out yourself. You can give it a little wash with some water. But really, it stays in there. So it should be really comfortable. You shouldn't feel it in there. You can put this in if you're someone who's had an operation, or you've got a bit of a prolapse. And you may have a vaginal ring, like quite a hard vaginal ring, plastic ring. These can go in with that. They're brilliant. The vaginal ring would normally need to be changed every 6 months, but these can be popped in and out every 3 months, and they can really help, because the vaginal rings can be a bit sore sometimes and cause a little bit of bleeding, especially as women get older, if the vaginal tissues become thin.
It seems.
Sorry, it
seems that there are loads of options, and it also seems that it takes a little bit of time for it to work. Lavinia, when people start moisturizing and they start having a proper regime and they remember to moisturize the vagina every day, for example, how long, from your experience that women shared with you, does it take for women to see an improvement with the moisturizers alone?
We recently did an amazing survey, and I don't have the results with me here, but it's almost instantaneous. We get people saying, oh my goodness, the relief was just so, and that is because the formulation does rehydrate almost immediately. And actually, I know that we're nearly out of time, but what it would be really helpful for Carys to confirm is, we've talked about the vaginal estrogen, we've talked about vaginal moisturisers and lubricants, but actually there is a way that you can combine the two. So Carys mentioned that the vaginal estrogen you use every day for 2 weeks or even 3 weeks, and then twice a week or 3 times a week. So you can still use the vaginal moisturizer on the days that you're not using the vaginal estrogen, and obviously you still need to use lubricants for intercourse. So probably best, if you're using a little tiny pessary, that you you have sex first and then you put the vaginal pessary in afterwards. You wouldn't necessarily want to mix the two at exactly the same time. So I know that it was Nick Panay who recommended very early on that the 10 micrograms of estrogen that you use twice a week is not nearly as high a dose as the previous, sort of 4 or 5 years ago, they were 25 micrograms. And so people sometimes find that they just need a little bit more, a little bit something extra. And that's where the vaginal moisturizer can come in very handy. So the NICE guidelines do actually say to doctors, please recommend to your patients that vaginal estrogen can be used alone or in combination with moisturizers and lubricants. So I think that's a really important thing. It's not one or the other. They can actually be used in combination. Would you agree, Carys?
Absolutely. I always give people both. So I always say that here you are, and this is the information about the moisturizers and the lubricants as well. And particularly, I love the sort of slip and slide sort of thing, because women, if things are dry, then they want to be they want to be enjoying sex as a pleasure for them and something which is intimate and connecting them with their partner. And they don't want to be really worried, is it going to hurt? Am I going to have some bleeding? So they want to, it gives them that reassurance that they've got something which is actually really nice and fun to use, and it's not going to hurt them, and they can be confident with their body then, so they can start then to relax, and that can really help as well. So yeah, by all means, I absolutely use both. So and it's really important to do that as well, and just give them confidence with their body as it has changed with any treatment and with symptoms that they may be happening, that may be having. And there are 2 other products just to let people know about. So there's an oral tablet here, which can be used at 60 milligrams a day, and there's Intrarossa, which is prosterone, which is a DHEA treatment as well. So I know we're running late on time, but these are some things which, if you look at, I've got it here. You're looking for more information about this, the BMS have got an information leaflet on urogenital atrophy, they call it. So they haven't changed the name back down to the genitourinary syndrome of the menopause. And there's lots of information there on the different products that you can use. And so just going to your doctor and discussing that, might this one be right for me? What sort of thing could I look at and add into my vaginal moisturizers and lubricant and intimate care regime? And then you know sort of which products you think might suit you better. So if you're someone who prefers to use a finger, great. If you'd like an applicator, great. If you think a ring would suit, brilliant. So I always give women a choice, say, what would you like? So today someone was going, oh no, I don't want the ring, but I've got the cream, and I think I could try that one as well. So it's like a little shop. So you can see, well, what actually, not everyone likes the same thing. What we feel comfortable about doing is different. So some people will feel really comfortable with something that other people won't like.
Yeah. And we just had a few questions earlier about, can we only get Yes from the GP? Well, that's not true, isn't it, Lavinia? Because Yes is a brand and can be bought online as well. Talk us through how we can access those different treatments. Of course, vaginal estrogen from your GP. Maybe you need to speak to a menopause specialist, to talk to your oncologist. Talk us through access. Lavinia, how does how can you access Yes through the GP?
So the vaginal moisturizer, which is the Yes VM, and the Yes water-based, are both available from the GP on prescription, either in a tube or in the pack of applicators. So there are 4 products that are available through your GP, and you probably do have to ask them, because many GPs are still prescribing Replens, which is one of the first vaginal moisturizers, goes back many, many, many years. It doesn't suit everybody, but the knowledge hasn't necessarily got out there. But Yes is available through your GP. It is also available directly from our website or from Ocado, from Superdrug, and that's a bigger range. That includes the washes, the oil-based, and also we have a little clitoral stimulant called Yes, Oh Yes, for people that are finding it difficult and I can't sleep, it's disappeared.
I love your toolboxes
here
today.
Here's my toolbox. Yes, is an organic oil, clitoral stimulant. So I think Carys mentioned sometimes post-cancer, post-menopause, our clitoris becomes less sensitive and less easy to be aroused. And this is a product that you just put a tiny bit of oil and it can definitely help with arousal and pleasure. So that's available directly from our website. And as I say, there are lots of independent health stores and natural product stores that sell our products, but it's probably best to come directly to our website, because there you get all the background knowledge. You get fantastic team of customer service ladies. If you've got any questions, you can do live chat, you can call up, you can send an email. So what we do is offer so much more than just the products. We offer support, education, information, and we're there for everybody if they've got any questions. No question is too intimate.
And I think sometimes people walk away from conversations like today, and it's a lot. Like, you know, people might not have even heard that there are more than one option of vaginal estrogen. They might think it's not an option for them. We just have a lady in the chat who said her oncologist said no to any HRT after her triple negative breast cancer. I wonder, and we're not going to go into details here because obviously we can't give medical advice, but I wonder whether if this lady saw a menopause specialist, whether vaginal estrogen would be no problem, for example. And so we always have to continue asking. If our problems persist, we have to go back and ask the question, right? And say, I've still got these problems. Who can help me? It's not fair that we're left on our own. And I think sometimes we listen to these conversations, and like someone said earlier, Lavinia, you're so knowledgeable. Carys, you've brought so much information in 20 minutes. We often walk away and we then think, oh my gosh, what do I do now? Like, what do I do with this information? And it might be weeks until someone listening to this conversation goes out and seeks the help. So in the meantime, phoning a chat lane or phoning Breast Cancer Now, for example, who've got a great hotline staffed by nurses, can be a really good step in starting to talk about these issues. Because like you said earlier, Carys, it might be really difficult to have the conversation with your doctor. Imagine if that doctor is male, and it's not very easy to talk about all of these issues.
I think you're right. And some people, when we speak about it, they do say, you know, a lot of people comment, oh, I just couldn't have this conversation with a man. And actually, maybe you do have to definitely find someone that you feel comfortable talking to. And I'd specifically asked that lady with the estrogen negative breast cancer or triple negative breast cancer, I think you said, to please go and get and speak with a doctor about that, because it is really important to make sure you're getting information as evidence changes. There's more confidence in prescribing different products. So yes, if it's a symptom, and we also need to think very much about. So one thing I would love to just get across is that there is no woman who cannot ask, no matter what your cancer type, no matter what your estrogen receptor type, you can always ask for help. No matter what you think the answer might be, it might be that you need to go and see a doctor and a menopause specialist who is really able to talk with you about the risks and the benefits of the treatment for your particular type of cancer, because they will all be very different. But in a majority of women, we can use these very low dose vaginal estrogen products. So it's just being sure that you've spoken to somebody who is appropriately trained and is going to be able to help you with that. And often looking for someone on the British Menopause Society specialist website will be able to guide you towards having those conversations. And actually, there are lots of NHS clinics that are available that will also have people who are really highly trained in menopause. So just finding the right person so that you always get the support you need.
Yeah, we had a lovely comment halfway through, Carys, just before you joined us, about how fantastically knowledgeable Lavinia is. A lady is just saying, I wish that Carys was my GP. And I thought that all along myself.
Yeah.
I wish you were my GP. And a lovely Faith just said, I've learned so much today and so much to remember and take in. Fantastic, Danny. And I do think that only like 10% goes in from these conversations. And sometimes we need to revisit the conversations, or we get it out on the podcast. Pen and paper needs to come out. This is not a do the dishes. And sometimes we just need to sit down with pen and paper and think, okay, what am I going to do with this information? What are my symptoms? Which ones have been persisting? which ones do I want help with? And then we need to go out and get that help, because I think, especially when there's a bit of shame and fear about talking associated, we're even more reluctant to go and get the help. But we do deserve that help. And from listening to both of you, that help is there, isn't it? It's a symptom that can be really tackled.
Yes, absolutely. And it's really common. So 80% of women may suffer from this as we go through and get older anyway. So if we think it's that many women, and how many have not said anything and have suffered on, and we have a long way to go. But I think there are a lot of older ladies out there now, and not just younger women, it may be their mums. And in fact, I had a lovely lady who came recently, and she said, it was my daughter who told me. She said, you don't have to suffer like this, mum. You go and get some help. And she
amazing.
And it was an amazing conversation to have with her. So and so lovely that actually we're supporting our older generation as well, you know, aunts, grandmothers, you know, just talking more openly.
Absolutely.
Which was just fantastic.
Jessie just said, I need to get some of that clitoral stimulant. Go for it, Jessie. I've got it. And I will share my discount code with you so you can get a discount when you get it. Another lady said, this has been so wonderful. I'm feeling so emotional. Oh, the Yes products are great, but my GP did not tell me about them, even though they prescribe it. I know, but now you know, and you share that information with everyone, Louise. And Colette is asking for the website. I will link to that website in our messages and show notes. Jessie said, amazing, thanks, love. Yes, tell me, Lavinia. And then we need to wrap up, because people must be getting hungry.
God, we could just go on. There's even more. What I wanted to say was, you know, on social media, when you have a live and there are comments, and the person, whether it's Davina McCall or whoever, they can't answer. And a medical professional can't answer all those questions. But what I would like to say is that if anybody would like to email me, if they've got, as I say, I'm not a medical professional, but I can always signpost people. So if they want to email me directly, it's just lavinia@yesyesYes.org. I can point them in the right direction. I really am happy to help like that, because it's, as you say, everybody's going to go away and there might be something they think about later. And where do they get the answer if they don't have a menopause specialist or their GP isn't very sympathetic? We've had this conversation, we've given lots of information, but I'm still here. I'm not going anywhere.
Oh, thank you.
So please.
You're all amazing. Thank you so much. Don't offer that, Carys. Otherwise, you've got lots of people knocking on your GP's door.
Thank you. Yeah, thank you. Lovely to come on today, and thank you, Lavinia. You've been amazing. I need to get some more products to give out.
All right, I'll sort that out for you.
Yeah, definitely.
I would love to talk more, because in the past, when I spoke to Lavinia, we spoke about dilators and sex toys, and I have embarked on so much learning about my own sexual health, especially when I was transported into menopause because of my cancer. And I kind of realized that I wasn't very educated about my own sexual health and pleasure and intimacy in general. And so I'm waking up to lots of things, Jessie, like you will, to the clitoral stimulant. And I think it's all positive. I know a lot of women are really suffering, and it's great that you both explained there's lots of help out there. And alongside of it, I think it's positive because it's a little bit of a rediscovery of who we are and ourselves and our bits. Like, we just call them our bits. Like, I love it. We use all these great words: vagina, vulva. It's good to be here, and it's good to do this together. And I can't thank you both enough for spending your time with us today. Thank you, Lavinia. Thank you, Carys.
Thank you, Danny.
Thank you so much.
I am so filled with love for every single woman in our community. When we stopped the recording, we all had a really lovely 10 minutes to chat to one another, to just know who's in the room. And I know you don't sort of get that same experience if you're listening back or watching back at a later stage. But for everyone that joined me live, we get a real sense of connection, which is amazing. I know we've all been through so much. And if you're listening to this, I know you've been through so much. You've had this cancer diagnosis, and then you've almost had this insult to your injury, which is menopause and other long-lasting side effects of cancer treatment, the surgeries maybe you've been on, and it's a lot. So I know by the time I connect with people, we've all bringing so much difficulty into our present moment. And I will never forget that, because your journeys are also my own journey. And when I speak to the experts, I'm always the patient, and I'm always also the patient that asks the questions on behalf of all of you at home, because I truly love connecting to you all. We just had so many lovely messages in. One lady said, Danny, just to say another huge thank you. I've spent the most worthwhile time with you and your guests on the hair and sexual health workshops. I've learned so much. You make us all feel less alone and more empowered with everything you offer. Podcast, your Instagram, your Facebook, it's just wonderful. I feel so supported from the bottom of my heart. Thank you again. And I can't tell you how grateful I am that I'm able to do this, that I'm able to bring together all of you at home listening to this and watching this back, and our community of experts. It's a true privilege to be here and almost be the middleman and to be able to connect to you. I know it's a huge privilege, and I'm very grateful I get to do it. And so in the future, if you feel you want to connect with us, connect to us in whichever way feels good for you. Some people really don't want to come into a Facebook group and do the chatting there. That's okay. Come and join us for a workshop or read the online resources. Go back through all of the podcast episodes. Maybe this is how you learn. But make sure you reach out to someone who has shared experience, a menopause buddy, as I call them, or another friend who you can just tell about what is going on for you. Because I always feel that when we are able to say it, it just becomes a little bit later for all of us. So make sure you connect to us in whichever way is okay for you. I'm going to put as much into the show note as possible, all the links from our experts, the code again for Healthy Whole Me for yesyesYes.org/Healthy Whole Me. If you want to buy yourself some Yes products, remember you can also get them from the GP. And with that, I'm going to love you and leave you, and I see you and hear you again next week on the podcast.